When it comes to fixing disc bulges and pinched nerves, again, it's generally very easy once you know how and what makes it worse. Now again, as we've talked about, we have to remove the cause, so you have to stay out of the forward head posture. Now the other thing you're going to do are the exercises from step 2, which is the double chin and the tennis in the sky, as we've talked about before. You're doing exactly those exercises as I've explained before. But let's look at what's actually happening when you've got disc bulges and pinched nerves, because once you understand exactly what's happening, you'll have a better appreciation for exactly the posture that you need to keep in. Now, when you're in good posture, the vertebrae are pretty much lined up on top of each other, and the discs that sit between the vertebrae have fairly even weight distribution. However, when you get into this position, these lower cervical vertebrae then go into flexion. Now imagine my hands are your vertebrae. Between my hands, imagine a balloon. That balloon represents your disc. If I was to push like that, the balloon would get pushed this way. Likewise, if I was to push that way, the balloon would get pushed that way. Now your disc acts exactly the same. When you're sitting in flexion or slouched position in forward head posture, your lower cervical vertebrae are pushed like that. They're flexing, which is pushing the disc backwards. Now what happens is you've got ligaments trying to hold that disc in. Now after a while, these can strain and they can actually tear. And what happens then is not only can they cause local pain, but that disc can then bulge or herniate backwards. And then there are nerves right back, and if that touches on that nerve, then that can start producing symptoms depending on the nerve across your shoulder, into your arm. It can be pins and needles, perhaps numbness, pain, aching, or even lancinating pain. So we need to get this disc away from the nerve. So you know if you're in that position, that's flexing the vertebrae, pushing the disc backwards, which is getting closer to your nerve. However, just like the balloon, if we can extend the vertebrae the opposite direction, we can push the disc away from the nerve. And that's exactly what happens when you do the double chin and the tennis in the sky. It places those lower cervical vertebrae into extension. So just like the balloon, it pushes the disc away from the nerve. So when you are doing these exercises, just like before, you'll do the double chin first day. Just the double chin every waking hour, 10 repetitions, 3-second holds. Then you'll include the tennis in the sky, if pain permits, the second day. What you're looking for is a reduction of symptoms in your arm or hand or forearm, depending on where your symptoms are. But let's say, for instance, you've got tingling down your arm, even into your fingertips. What you're doing your exercises and you're wanting to see a lessening of symptoms in your arm. And what you should probably see is the fact that you'll stop having symptoms further down your limb. In other words, let's say it was all down your arm, and then after you've done the exercises, let's say the next day, you only have it now in your upper arm, no longer in your forearm and hand. And this is showing you that your condition is getting better. Another way for you to know that your condition is getting better is if you had numbness in your hand, and now it's not numb, but it's tingling. That is showing you that your condition is improving, and is a green light to continue with your exercises. So you will continue doing these every hour until you have no more symptoms in your arm, hand or shoulder. Once you're symptom free, then you'll just simply go back to doing the exercises 2 or 3 times a day, and like we did in step 3, removing the restrictions. And just like before, if you have your pain returns or you get symptoms in your arm that return, then all you do is 1, stay out of the forward head position, and 2, go back to doing them every hour to remove those symptoms again. And then they should abate and leave you. So it is as simple as that. Now you know the exercises put extension forces on your vertebrae which push your disc away from the nerve. Stay out of the forward head posture, and your ligaments can then heal Just like, let me give you an example. If you were to cut your elbow here, but you were to continue bending that elbow, of course that cut wouldn't heal because you continued to aggravate the area. Now your neck is exactly the same. If you continue to be in that forward head posture, those soft tissues, again, it's like bending your elbow. They don't get a chance to heal. And this is one of the major reasons people continue to have neck pain. They keep aggravating that area. So, good posture, do the exercises until you have no more symptoms in the arm, and that is how you treat your own disc bulges and pinched nerves.